Hello guys, how are you? Welcome to our channel, Last Minute Pharma, your exam antidote, okay? Today we are here with a new topic. This is lecture number 4 of the General Pharmacology series, and today we are going to discuss about metabolism, one of the very important topic, because 100% question you will get on your phase 1, phase 2 metabolism. What is phase 1 reaction? What is phase 2 reactions? Okay, it's a very simple topic, okay? You just have to understand the basics, okay? See, till now we have understood that how the drug is going to enter inside the body, okay? Then we understood that this drug, after entering inside the systemic circulation, this drug is going to go to the different parts of the body. Now, after the work is done, after the therapeutic activity is shown, where does the drug go? That becomes a question. Okay, this drug which is there, this will undergo a process of metabolism. What is a metabolism? Metabolism is nothing but biotransformation. This is a biotransformation. So now it's a very common question which you get. What does biotransformation mean? It's nothing but a chemical alteration. Okay, it's nothing but a chemical alteration of the drug in the biological system. Okay, that means in your body, the chemical alteration of a drug in a biological system. Now the question comes over here, why do we need metabolism? What is the main function of metabolism? Why do we need metabolism? Metabolism is nothing but, this is coming under inactivation of a drug. This is coming under category of inactivation of drug. To inactivate the drug, because you don't need a prolonged action, right? After showing a proper therapeutic activity, this drug which is there, it has to get inactivated. So for that, we are going to have metabolism. We are going to have metabolism. Is it clear? Now, the question comes, where does the metabolism happen? Metabolism which is there, it generally happens in, my friends, you remember the bartender which I was talking about in the story? What is the bartender doing? Depending on the various enzyme, okay, various enzyme. So what is the bartender going to do? He's going to make different drinks, right? Similarly, this liver which is there is having different enzymes, okay? This liver which is there is having different enzymes, and these enzymes which are going to help in the metabolism, So actual site, if you see, or the main site, majority of the site which is the major site is nothing but the liver. Major site which is there, that is nothing but the liver. Then later you are going to have the GI tract. Even the GI tract, even the GI tract also the metabolism can happen. Then even some drugs are going to get metabolized in the blood also. Some blood will get metabolized, some drugs will get metabolized in the placenta. Okay, so there are various sites, but majority of the drugs which are there are going to get metabolized in the liver. Now one important concept is there. Pay attention over here. That is, see, when we discussed about the factors affecting absorption, okay, we told that for a drug to enter inside the biological membrane, you need the lipid solubility. The drug which is there has to be lipid soluble. Okay. Now, once this drug has been absorbed, with the lipid solubility, you need lipid soluble drug and you need an unionized drug. Okay. Now, once it has been absorbed, for distribution, again, what do you need? See, for the drug, it has to get solubilized, right? The drug which is there, it has to get solubilized. So even it is supposed to have some water solubility also. Yes or no? It has to have some water solubility also. So then once it is solubilized, then what will happen? Then this will go to the liver. So what is the thing over here you have to remember? This liver which is there, okay? This liver which is there is responsible for making this lipid soluble drug, into the water soluble drug. This liver which is there, it is responsible for converting the lipid soluble drug into an water soluble drug, or you can say an unionized drug into an ionized drug. Now the question comes, why do we need a water soluble drug? Why are we converting it water soluble? Because for this drug to be excreted by our friend kidney, okay, for excreting, there is this process which is called over here, right, in tubular, when having loop of Henle and you're having reabsorption rate. So if it is a lipid soluble drug, it will again get reabsorbed. It will not be excreted. So for excretion to happen through urine, so what this drug has to be? This drug has to be water soluble and in the ionized form. Only when this drug is going to be water soluble and ionized form, this will be able to excrete. Through your kidney, or that means a nephron. This will be able to get, this will be able to pass through in the urine. Did you understand? This is a very important concept, okay? So metabolism is nothing but we are converting a lipid soluble drug into a water soluble and ionized drug so that it can be easily excreted. Okay, I hope it is clear. So for this to happen, for this conversion to happen, you are having two phases of metabolism. How many phases? You are going to have two phases of metabolism. Now the first phase metabolism is called as phase 1 metabolism. Is called as non-synthetic reaction. It is called as non-synthetic reaction. That means what is happening over here? There is no synthesis of a compound. It is just like addition of oxygen, removal of hydrogen, converting a long chain into cyclic compound, converting a cyclic compound to a long chain. Okay, that is coming under the phase 1 reaction. That is nothing but non-synthetic reaction. Now, one pay attention over here. Okay, if the metabolite, if the metabolite of phase 1 reaction, if the metabolite of the phase 1 reaction is a polar compound, if it is a polar compound, that means polar means what? Water soluble, right? Polar means water soluble. If it is a polar compound or water soluble compound, this will get excreted through the urine. This will get excreted through the urine. But even after the phase 1 reaction, if the drug or the compound which has been formed, it is a lipophilic compound. If the reaction or if the compound which is there is lipophilic after the phase 1 reaction, this is case 1. This is case 1. If it's polar, it will be excreted. But if it is a lipophilic compound, this will enter inside the phase 2 reaction. This will enter inside the phase 2 reaction. So what is happening in phase 2 reaction? Whatever endogenous substances are there, okay, whatever endogenous, like for example, you're having glycine, you're having your acetyl group. So these polar compounds, these lipophilic compounds which are there, these are going to get conjugated. That is why your phase 2 reaction is also called as conjugation reaction. That means joining. Okay, so when these compounds like glycine is there, glutathione is there, your gluconic acid is there, sulfuric acid is there, when these compounds are going to combine with this lipophilic substance, then these metabolites will turn into non-polar. Then this will turn into non-polar, and that is what we want, right? That is what we want, so that it can be excreted out. I hope it is clear. I hope it is clear over here. So what are we doing? First, we are having a polar compound. It's nothing but a water soluble. So it's getting excreted. So it's going to get excreted. Okay. But now over here, we are converting. For example, what are the metabolites are getting? That's a lipophilic drug over here. Okay. This lipophilic drug will conjugate. This lipophilic drug which is there will conjugate with other compounds like sulfuric acid, gluconic acid, and then this will become your water soluble. Then this will become your what? I think I told non-polar. Just correct it. Okay, I think I told non-polar. It is not non-polar. They are converting into polar. Slip of a tongue. Okay, not of non-polar. It is polar only. So then you are going to convert these things into your water soluble or your polar, and then it will be excreted out through urine. Now, one very important question comes: how do we remember the phase 1 and phase 2 reactions? Okay, so I have made code for that. You can remember that. Okay, so see, I'll just erase this for now, okay, so that confusion doesn't happen over here. I'm just explaining you a bit about the phase 1 and phase 2 reaction. We will be going into it, but just have an idea over here, okay. So see, in the phase 1 reaction, if we talk about the phase 1 reaction, what is happening in phase 1 reaction? Remember, we remember ROH, that is rho, okay, rho in Hindi, right, okay. And there is one friend called CD we are calling, okay, CD or DC, whatever you can tell it, okay. So, or maybe you can just remember, okay, when IPL was there, Delhi Capitals was like in the semi-finals, okay, but it was not able to win. So, rho DC, okay, Delhi Capitals, okay, rho DC. So, how can you write over there? See, R stands for reduction reaction, O stands for oxidation, your H stands for hydrolysis, D which is there will stand for decyclization, and C will stand for cyclization. See, please check out the spellings, okay, I'm just telling for the code, okay, check out the spellings, okay. That is your rho DC, that is going to be your rho DC. This is to remember your phase 1 reaction. Now, after the phase 1 reaction, if the compounds which are there are polar, if these are polar, then it will be excreted. Then these will be excreted through your urine or bile. But if it is non-polar, non-polar means what? If it is your lipophilic, lipid loving, lipophilic. If that is non-polar lipophilic, then what will happen? Then these substances which are there, they will join with your endogenous substance. they will join with endogenous substance, and this is what is your phase 2 reaction. That is what is your phase 2 reaction. So what is this endogenous substance over here? This endogenous substance can be your sulfuric acid. Yes or no? It can be a sulfuric acid. It can be gluconic acid. Okay, so different types. Let's just check it out. Okay, so different types of endogenous substance when they are combining with each other. Now, when these two are going to combine, this is again going to give you polar metabolite. This is going to give you polar metabolite, and this polar metabolite will be again excreted by my friend, that is your kidney. Are you understanding? Are you able to understand this? This is a very important concept. Okay, fine. Now, how do you remember your phase 2 reaction? How do you remember your phase 2 reaction? Very simple. Okay, very simple code to remember over here. For phase 2 reaction, you remember when in my age, no, there was a Samsung phone, no, now also it is there, but the old phones. Okay, so Samsung old phone, we are remembering with 3G. Okay, that time 4G and all was not there. Okay, now 5G also has come. So we were having this something called as Samsung, that means SAM 3G. SAM 3G. Okay, now how to remember? S will stand for sulfation, that means addition of sulfur group. Okay, then A will stand for acetylation. A will stand for acetylation. M which will stand for methylation, that means addition of methyl group. I told you no, endogenous substance combining with this. If it's a sulfur group, sulfonation. If it's a methyl group, methylation. If it's acetyl group, acetylation. What does the 3G stands? 3G will stand for, there's something called as glycine conjugation. Then your gluconic acid conjugation. It's also called as gluconation. Then you are going to have your glutathione conjugation. Glutathione conjugation. This is what your 3G is going to stand. So very simple way. It is very simple. See, you might feel it's difficult because a lot of things are written on the board. But you just have to remember your phase 1 and phase 2. This transformations you have to remember very clearly. This transformation you have to remember very clearly. There is phase 1 reaction, and then you are going to have the phase 2 reaction. This is phase 1 reaction and then phase 2 reaction. Now, sometimes you always think that first phase 1 is going to happen, then phase 2 is going to happen. But that is, majority of the drug will obviously go phase 1 and then phase 2. But there are some drugs which will go first, they will enter inside phase 2 metabolism and then they will enter phase 1. So don't have this misconception that only that phase 1 is going to happen and then phase 2 is going to happen. Okay, first, obviously, phase 1 will happen majority of the drugs, then phase 2, but there are some drugs like isoniazid in which what is going to happen? First your phase 2 metabolism is going to happen, and then what is going to happen? Then after that you are going to have your phase 1 metabolism. Okay, so now you have understood that you are just having an inactivation. Metabolism is nothing but inactivation of a drug. Now, three things you have to understand very carefully over here. Okay, 3 things you have to understand very carefully over here. Just have a note or have a eye over here. This is very important over here. See, mainly what is going to happen in metabolism? Mainly what is going to happen in metabolism? That maybe an active drug which is there. Okay, maybe an active drug which is there, that is going to get converted into inactive metabolite. Yes or no? That is what is metabolism. No, active drug into inactive metabolite. But there are some drugs, if there are active drugs, then they will convert into active metabolite. Okay, then you have certain drugs which are initially inactive. They don't have any mechanism. Okay, they won't show any action. There are some drugs which are going to be inactive initially, which are going to be inactive drug. But after metabolism, they will start showing activity. Okay, after metabolism, they will show activity. This is your active metabolite. Okay, so those drugs, this is very important. Those drugs which are inactive initially, okay, they won't show any action, but after metabolism they will show action. These kind of drugs which are there, they are called as pro-drugs. They are very pro. Starting they won't show their colors. After metabolism, they are going to show the therapeutic activity. Okay. One of the examples for active drug and inactive metabolite, you can remember about your phenobarbital. Phenobarbital which is there. After metabolism, this will convert into hydroxyphenobarbital. So in this, phenobarbital is a active metabolite. Active drug. But then this is a inactive Inactive metabolite. This is a inactive metabolite. Now there are some drugs which are going to be active, and after metabolism they convert to active metabolite. For example, your codeine which is there. Your codeine which is there, that will after metabolism this is going to turn into morphine. This is going to turn into morphine. Now for example, there are some drugs which are inactive drugs. For example, your carbidopa. You know, carbidopa will talk about levodopa. This is an inactive drug. Initially it won't have any activity, but after metabolism, when this will happen, this will become a dopamine. After your metabolism, this will have dopamine, and this dopamine will have the activity or the pharmacological action. I hope it is clear. This part is very important, okay? Now we'll be learning what is the importance of this prodrug, and this is a very important concept. There are certain advantages which are associated with this prodrug. Initially, they won't show any color, but as soon as it gets metabolized, it is going to have an action. Okay, so now we are going to talk about prodrug. Okay, so what is a prodrug? Prodrug means initially when you take this drug, no, it does not have any activity. Okay, it's going to be inactivated, but once it gets metabolized, once it is going to get metabolized, then the therapeutic outcome will be seen. Then the therapeutic outcome will be seen. I hope it is clear over here. Okay, so prodrug initially it is in inactive form, but once it is going to get metabolized, it is going to get active form. So what are the major advantages? Very important advantages are there for this prodrug. Okay, now for example, I will tell you, it is going to increase the bioavailability of the drug. Okay, I hope bioavailability concept is clear. Okay, if not clear, please refer my before lectures. Okay, so what is going to happen over here? Try to understand. It's very simple. So there is a drug. See, there is a condition which is called as Parkinsonism. Okay, so Parkinsonism which is there now. Parkinsonism. This is because of deficiency of dopamine. This is because of deficiency of dopamine. So what we do, we have blood-brain barrier, right? Dopamine means in the brain, okay, in the cerebral area, we have dopamine deficiency, okay. So what the solution is that we have to give the external dopamine, okay. That dopamine has to go inside the brain. But now the problem over here is this dopamine which is there. This dopamine which is there is not able to cross the blood-brain barrier. It is not able to cross the blood-brain barrier. So what do? We are giving a prodrug. We are giving a prodrug, and the prodrug of dopamine is nothing but your levodopa. It is nothing but your levodopa. This levodopa, see, dopamine cannot cross the blood-brain barrier, but this levodopa will be able to. I'll just extend the blood-brain barrier over here. You can understand this is blood-brain barrier, and this levodopa will be able to enter over here inside the brain. And with the help of your dopa decarboxylase, okay, see, don't panic, don't get this thing, what is the dopa decarboxylase? This is just here to understand the concept of your prodrug. Okay, why do we need a prodrug? So this prodrug is there, levodopa, it is inactivated, it will not show any activity, but once it enters inside the brain, because see, once it enters inside the brain, with the help of dopa decarboxylase, this levodopa which is there will convert into dopamine, and this is how this dopamine, deficiency of dopamine can be compared, or because the deficiency, no, so we are giving the concentration of dopamine by this method. We cannot directly give dopamine because it cannot cross the blood-brain barrier. That's why we are giving it in the form of prodrug. So as we are giving in the form of prodrug, the complete drug is getting to the site of action. The complete drug which is there is entering in the site of action. That is why I told increasing the bioavailability of the drug. Now next concept which is over here that you have to understand, that it is going to increase or prolong the duration of action. Okay. Now see, try to understand simple thing. Now once you take a drug, okay, it's going to get absorbed, it's going to get distributed. Okay. Now over here you have to understand that some drug is there which will get metabolized. Okay. Some drug which is metabolized, and some drug is there which will not get metabolized or will not show action also. It will not show any action. But over here, what is going to happen? The drug will show action only after metabolism. So the whole prodrug which is there, will go metabolism. And if you see comparatively, see, distribution will happen, it will go to the action. Okay, but the action, the onset of action, if you see, or the duration of action is comparatively less. But now, as the metabolism is a slow process, metabolism is a slow process, so this prodrug that is there, no, it will get slowly metabolized. It will get slowly metabolized. So the metabolism is slow of the prodrug, and what will happen? Slowly the prodrug will convert into active drug, and this active drug continuously, slowly will be having the release of the active part of the drug, and that will show the action. That's why I told you over here is that this prodrug which is there, it is going to prolong the duration of action. Isn't it interesting? Okay, so for me this part is very interesting. Okay, now next one is, it is going to prepare, or is going to give a site specific drug delivery. Okay, now for example, there's a drug which is called as methamine. Okay, methamine or methanamine. Okay, just check it. I'm not sure. I think it is methanamine. Please check it out. Okay, if I'm otherwise I can just write in comment section. I'm not sure. Okay, so one drug which is called as methamine. Okay, methanamine. So what is this drug? This is a prodrug. This is a prodrug. Okay, this is not going to show any action. Okay, this is not going to show any action. But now what is going to happen? You know, when this drug will come under the contact of, acidic pH of urine. Check it out. When the drug will come under the contact of the acidic pH of the urine, okay, acidic pH of the urine, this drug is going to get converted into formaldehyde. This will get converted into formaldehyde, and this is going to act as an antiseptic in the UI tract or urinary tract. Okay, this is going to act as a antiseptic, because you know, in the urinary tract infections, no, this is going to act as a antiseptic in the urinary tract. Is it clear? See, this is initially prodrug, doesn't have any function. But as soon as this drug, see, it's not having any function, as soon as the drug comes under contact of acidic pH, then it is going to convert into formaldehyde, and then it is going to show the antiseptic property. I hope it is clear, okay, the advantages of the prodrug. Now, next we'll be discussing about mainly what is this phase 1 reaction, phase 2 reaction. See, already I discussed, it's a very simple topic, reduction, oxidation, but I will just give you a brief about it and what you are supposed to remember for the phase 1 and the phase 2 metabolism. Okay, so now we are going to discuss about the phase 1 and phase 2 metabolism, or phase 2, phase 1 this thing, like part of metabolism. Okay, so now this again I have told you, again I'll repeat it, this is a very important part. See, usually what happens is every drug is going to go under, like say I told you again, majority of the drugs which are there are going to go under the phase 1 reaction first. Okay, so in phase 1 reaction what is going to happen? This is a non-synthetic reaction. This is a non-synthetic reaction, or this reaction which is there, phase 1, this is also called as transformation reaction. Is called as transformation reaction. Okay, so what are we trying to convert? Then whatever our lipophilic drugs are there, okay, or lipid soluble drugs are there, or unionized drugs are there, we are going to convert that into polar drugs. Okay, we are going to do that, or we are going to convert into polar drugs. Now, how do we convert into polar or ionized drug? By this method. That is here rho DC. Okay, rho DC. Again, I remember about the IPL. The semi-finals was there. DC was, I don't remember exactly. Remember, make it hypothetical that DC was there in the final. Hypothetical situation. Okay, always RCB will be there. But anyway, I'm telling you, in the finals we are having your DC, but DC is going to, what will happen? Cry. Okay, so it's going to be rho DC. Reduction, oxidation, hydrolysis, decyclization, and cyclization. Okay, simple meaning. Reduction means what? Removal of oxygen or addition of hydrogen. Exactly opposite is your oxidation. What is oxidation? Name of it is very simple. Oxidation means addition of oxygen or removal of hydrogen. Then what does hydrolysis mean? Hydrolysis means addition of water. Addition of water is nothing but your hydrolysis. That means with the help of water, you are going to break down that chemical drug. Okay, that means you are going to convert that drug into a water soluble substance. Okay, then you are having cyclization. What is cyclization? If you are having a long chain parent, like long chain is there, okay, then you are going to convert that into a cyclic structure. Okay, a linear structure is there, that you are going to convert into cyclic structure is cyclization, and exactly opposite, that is the cyclic structure, when you are going to convert into a linear structure, that is decyclization. So again I am telling you, examples are important, but these examples which are done to again revise. Okay, because I will exactly tell you, this is mugging up topic. Okay, the example you have to remember it, because what you will do, you see, exactly in detail you don't have to go. Okay, how that drug is undergoing oxidation, like how it's being POC, no, that's not required over here. Okay, just remember a few examples. With more and more practice, you can see our notes also. Okay, the notes also will be there. Okay, so in that you can have more examples. You can remember such a written any example over here. Okay, now After phase 1 reaction, whatever metabolite is there, two conditions. It can be either a polar metabolite or a non-polar metabolite. If it is a polar metabolite, then what is going to happen? This will get excreted via urine or bile. Okay, urine or bile. If it is a non-polar or a lipid soluble, then this will enter inside the phase 2 reaction. This will enter inside the phase 2 reaction. So whatever this lipid soluble drug is there, this will get attached to the endogenous substance. Endogenous means what? Inside only is there. Okay, inside the body system only these substances are there. What are these substances? That is your sulfuric acid, glucuronic acid, acetic acid, whatever. Okay, so when this endogenous substance are going to bind with the non-polar or lipid soluble drug, okay, that's why this is called as your phase 2 reaction. This is called as your phase 2 reaction, and this conjugate after your non-polar drug, okay, non-polar drug plus your endogenous substance are going to complete. They are going to form a conjugate. They are going to form a conjugate, and this conjugate which is there, this is again going to be. This is going to be polar, or you can say it is going to be your water soluble, and because of that it can again be excreted via urine or bile. I hope it is clear. Okay, now when this is combining with endogenous substances, if the endogenous substance is sulfur, then it will go into which reaction? Sulfation reaction. Addition of sulfur group, sulfation reaction. Which enzyme is responsible? The sulfur group is getting transferred, right? The sulfur group which is there is getting transferred. So this is going to be your sulfur transferase. See here also, acetic acid is going to get, or acetyl group is going to get transferred. That's why it is your N-acetyl transferase. Same, methyl group is getting transferred, trans-methylase. So you can see the trans. That means that group which is there, or the particular group which is there, that is getting transferred. And why is it getting transferred? To convert that lipid soluble drug into the non-polar, or into the polar drug, or your hydrophilic drug you can say, or water soluble drug you cannot say over here. See, glucuronic acid or glucuronidation, okay, is nothing but the drug which is there is combining with glucuronic acid over here. Okay, and the enzyme which is required over here is UDP glucuronosyl transferase. Again you can see transferase over here. Now again glutathione, again this is a chemical compound. When this group is getting transferred, you will tell glutathione transferase. Again glycine conjugation, when acyl CoA glycine is going to get transferred in the drug molecule, it is called as transferase. So what is the main challenging thing over here? That is the remembering which type of reactions are there in phase 1 and in phase 2. With the simple code you can remember Rho-DC and SAM3G. SAM3G, remember? So SAM3G will stand for what? Sulfation, acetylation, methylation. 3Gs will stand for glucuronidation, glutathione conjugation, and glycine conjugation. I hope it is clear over here. Okay. Now next we will move on to the what are the factors which are going to affect the metabolism.